That's also what is sort of found when looking at electroconvulsive therapy, ECT, which is used in patients with severe depression. And it is in many ways a last resort, but it's also a very effective therapy. So it works in more than 90% of the patients in whom it is being done. So in terms of curing severe depression and life-threatening depression, it's certainly the most efficient therapy that we have. The problem is that subjects, to some extent, lose memory. So you can see this is the number of years since a program went off the air at television, and the ability of the patients to remember the different television shows. So this is less than 2 years, more than 2 to 4 years, etc. And what you can see is that before ECT, subjects remember quite well what happened within 2 years. When you go to more than 2 to 4 years ago, their ability of remembering is just as good as if they hadn't had the ECT. So ECT definitely does interfere with part of the long-term memory, but only within the first 2 years or so.
Is that the cause of the loss of depression, that you can't remember, just like the other guy that was heavy? If you can't remember your trouble 2 years ago?
Well, it could be an effect of the disease that you've been depressed, but I mean, this is before ECT and this is after ECT. I mean, it goes down dramatically here. Yeah. So it's not just because of the depression. It's not because they become more happy that they can't remember. Because maybe it was very sad television shows, so by forgetting those television shows, they feel happy. That's probably not the case. It's the depression is not as such bad memories. It is something else which is being influenced. But at least the electroshock, where the whole brain is sort of being activated rather violently, but briefly, is a way of interfering with the long-term memory. Another way is to interfere with protein synthesis, and this leads us to a question of what is actually the molecular mechanisms involved in learning and creating memory. So this is from experiments in which rats have been given inhibitors of protein synthesis. And as you can see, the learning process is quite good. So this is different trials, and you can see that before, with and without the inhibitors of protein synthesis, everything is going okay. But if you then look at retention, their ability to remember what they have learned here at quarter of an hour, 3 hours, 24 hours afterwards, you can see that maybe their short-term memory is almost okay here. But if you look at 3 hours and 24 hours, it's really much worse than if you hadn't been giving protein synthesis inhibitors. So basically, the long-term memory is all about protein synthesis. It's actual changes in the brain which are taking place, structural changes caused by protein synthesis. Something has to grow out, has to change in some way in order for this memory to take place. This leads us also to questions in relation. I just have to see where this. It's just the test is coming very soon, and I just needed to check whether it was now. The enriched environment in rats is basically also something that has been used in order to see how long-term memory is being influenced by the environment. The idea basically being that with a more stimulating environment, you can see, expect to see more stimulation of the brain in the rat. They have more things to interact with, and therefore they learn more and they have to establish more memory, whereas if you're living in a cage like this or like this, you don't get many stimuli, you don't have to learn very much, and therefore you also don't create very much memory. So when looking into the brain of these rats, what you can do is simply to look at individual nerve cells like this and count the number of branches that you have of the dendrites. And what you see is that rats that have been living in an enriched environment have actually far more branches of these dendrites and much more spines and synaptic contacts than rats which have been living in a normal, so-called normal environment, which is actually a rather poor environment. So there are changes, structural changes also, which relate to memory. Just to give you an idea of what this looks like, this is some fascinating videos, which you can also find quite a lot of in YouTube. So what this shows is a small dendrite, which is running here. And all of these that you see here are connections from other nerve cells which communicate to this precise nerve cell. What we're doing in a little while is to stimulate one of the connections which connects to this nerve cell right here. And what you should see is what happens to the connection here, and look at the time. So it's marked with a red dot here, which tells you when the stimulation is being given. So there it starts. It went rather quickly, but have a look again. Stimulation, poof. You can see how it actually explodes, and it's all within just 5 minutes. And try to have a look at the other one over here. Again, the same thing. The connection to that exact point is being stimulated, and whoop, you can see how it grows out. So these changes happen all the time in the brain. Whenever we have activity, then within relatively short time there are changes going on, which is actually the basis for establishing of memory, that now we have had some activity in this circuitry, we have to establish a memory of this. Oops, you're not supposed to look. Okay, that was a small reminder. So now you're all going to get a piece of paper, and your task now is to circle the words that you remember having seen previously.